So in this lesson, we're going to continue on and we're going to focus now on just a generic overview of some of the interventions that we use in therapeutic rehabilitation. With all of these different goals that are often associated with therapeutic X and the return to participation in our injured population, we need to have a just overview of where different things can fit within this different system. So obviously this is going to be a team-based approach. The athletic trainer is not going to operate independently, but operate part of the sports medicine team. And the same things that we've talked about in sports medicine team-based application apply. So I want to remind you of that just from the standpoint that we're going to talk about this in isolation, but it is part of the overall team. Within the team component, the athletic trainer, right, is going to be usually the hands-on person with that, really implementing a lot of the treatments that we were looking to do to improve overall function there. So it's important that we have an understanding as a rehabilitation professional as well as an acute care professional. So when we get into evaluating a sports injury opposed to other types of injuries, some of the things that really make it different than others is we have some real major tasks that are going to be really important for us to return to normal in order for the person to be returned to participation. So these other sorts of things here, are fairly similar, overlapping and identifiable stages, interim goals to the next criteria. But really, we're looking usually to a much higher level of function in order for discharge to occur. So before we talk about interventions, it's important to go back and remember the importance of goal setting and an overall plan of care. We don't want to just be choosing interventions. We want all of these to be associated to a goal, that's associated to a root cause, that's associated to a problem, that is then associated to that medical diagnosis by the physician and our own physical examination. During that time, it's also important then that we identify factors that may limit adherence to rehabilitation, whether or not that is everything from student schedule with classes to participation status within the team, whether or not they are highly motivated or less motivated, but also just at the same note, what kind of drive do they have and what sort of additional motivation might we need to play. And establishing short-term goals that then lead to the long-term goals is a good way to increase adherence to our rehabilitation and ensure a better outcome. So when we're looking at our goals and plan of cares, we need to identify then, once we get into that aspect, whatever modality, and again I'm using modality in a broader sense than just electrical or what we would normally think of modalities. I'm using it to include rehabilitation things as well. What may facilitate the achievement of these goals, right? And that's what we'll talk about here as far as the overview. Just different options that might facilitate goals with it throughout the overall process. But we then also need to make sure we're looking at what is the rationale and the efficacy for those treatments. So towards the end of this class, we'll be going back through the modalities to look for these rationales and evidence of efficacy as we look to implement them. And it is important that we not only use the basic rehabilitation model, but individualize that to our current situation so that our plan can be progressive, right? The idea needs to be that we need to be including new modalities and discontinuing other modalities that are no longer warranted because we've already reached the goal that they were intended to treat. So when we get into therapeutic exercise now, which is what we're really focusing on as far as, overall modalities and how can we go about using this. Everything is going to be based on what we know about the healing process. And that's why we're focusing so much on the healing process right now, because we know that timing and the timing of the treatment response is going to be what really leads to effective care throughout this overall process. So this slide in this table shows a link between the healing phase, a basic timeline with that, and then I really wish these were opposite just because of the way that it goes. But we have goals and then possible modalities. And the reason I wish that it was opposite, right, is because the goal should come first, then the modality, right? You don't choose in the acute phase to use an ice pack, ice cup, cryobath, or cold pack, and then say, I'm doing it to relieve pain, relieve swelling, promote blood clot formation. You say, I'm trying to relieve pain, relieve swelling, promote blood clot formation, so therefore I'm using an ice pack. But this is an overall just basic a basic list now of different modalities and different goals associated with it. And so you can see some of these continue, right? The late proliferation phase, you can see cryotherapy is still there to possibly reduce inflammatory reflex from overly aggressive treatments, different component like that. If we start to get new acute inflammatory responses that are excessive, we may need to go back to cryotherapy. But you can see how early on in this you have more of the traditional modalities, and later on you can see more of the therapeutic exercise sort of stuff that gets into play there. And so this gives you just a good overview of those, and so that's something to consider. Again, now here in this table, we're looking a little bit more at rehabilitation components and some different techniques. Here, I like how this one's organized a little bit more. Here's the healing characteristics, right? And then the rehabilitation techniques that can help. So go ahead and take a look at some of these sorts of things, how they rely, how, it makes sense from the standpoint that during the proliferation phase, when type 3 collagen is forming, we're going to start to introduce some range of motion to help affect that collagen arrangement. Whereas once we are starting to add type 1 collagen, we're going to now move to resistance exercise as that tissue tensile strength increases overall. So I wanted to include a pharmacology reference just as a good review, because pharmacology does play a role in rehabilitation and the healing process. So a few terms just to review from previous components. The duration of action being the length of time that the drug is in the blood above the level needed to obtain a minimal therapeutic effect, right? That's the important component there. Half-life is the amount of time for the bloodstream level to diminish by half. And then steady state is once you reach kind of this aspect where the duration of action is continuous because you're replacing it at about the same rate that you're going through. After about 4 to 5 half-lives of dosing is when we get in there. NSAIDs are the most common, right, over-the-counter component with that. And so the OTC dosage is about half the equivalent prescription medication with that. So, I mean, you can theoretically just double the amount of ibuprofen and you'll have prescription ibuprofen level. I mean, that's the 800 milligrams opposed to the 400 milligrams that people take. Again, the concern of that is cardiac and kidney function being that it is a non-generic COX inhibitor, and so it's going to inhibit some of those, and then also be processed through that as well. Steroid medication can be used, but it has severe side effects, and its complete healing, our absence of healing, it completely stops the inflammatory process, so we don't get healing there. And then there are other drugs that can delay the process as well. And so I wanted to give you then again now if it'll let me. Here finally is the overview, the different drugs with that, their brand names associated, their basic dosage, and their maximum dosage. Review this again, just so that way we can make sure that you have that information that you need, at least general levels associated with that. So you have a general idea of the amount of drug that is indicated in these different situations. So wrapping up a little bit, or at least getting close to the end of wrapping up, when we get into rehabilitation component, obviously we need to be monitoring progress throughout. We cannot be reliant simply on timelines of healing or even just general protocols with that. We need to be constantly monitoring that state of healing and our successful completion of short-term goals. So that way we can continue to get that unrestricted training practice and then return to participation. And what we really need to be focusing on now then is the idea that as time occurs, our functional level is increasing. In this case, pain is absent, and so we do not have any setbacks, opposed to this stair-step manner where we have an overdone episode, a almost new injury that decreases our level of function, and then we go up through. Each day with our rehabilitation plan, we need to make sure that we are monitoring the overall health associated with the individual and the healing of that tissue, so that way we are not at a situation where we're overstressing the tissue, causing pain, thereby decreasing function, and then having to return to that level. Ultimately, our goal is to return them to previous function and full recovery, but the criteria associated with that is very difficult. The best recommendation is that it should be a team-based approach with that, where the team physician and the athletic trainer are ultimately responsible. You'll see different lists associated with full recovery, but the best way really is for you to incorporate aspects of the participation into your rehabilitation plan at varying levels and progress that, so eventually there is not much difference between participation in rehabilitation and participation in activity. So for example, you can do like basketball related activities, shooting, dribbling, different stuff in your rehabilitation plan. If somebody has an ankle injury, right, once they can stand, they can do some flat-footed shooting, do some dribbling components, then as they increase in their progression, they can start to incorporate more basketball activities with running, cutting and dribbling, eventually, layups, drills on air, limited contact stuff where maybe you as the athletic trainer or another coach or participant is being the defender or the offensive player, and they're defending you, where it's much more controlled. The other person isn't focused on practicing or getting better, but just serving as an aid for the injured patient. And then eventually into full contact stuff, maybe with days off in between. And eventually then the discharge becomes the fact that their rehabilitation plan just calls for continual participation. So the last part to consider now is always documentation, right? And the important component with that, the idea that we can use documentation to promote good practice with that. It's important to include the parameters of the modalities that you're doing. And I mean, this is just for the purpose of, even though you know the athlete may know, but it is legal document with that so you can prove what you did. But at that same note, it is helpful in case you ever want to be gone or a different component like that. So the rehabilitation plan is in place and people can go back and look at what you have been doing, and you don't have to like pre-write everything. They can look at what you have been doing and use their own judgment and make a plan for the next day. There are all sorts of different forms associated with that and different components. We looked at daily treatment notes in evidence-based practice course. Here's kind of a form that follows that similar sort of aspect. But then at the same note, remember now, we can be using our PROMs to monitor progress over time. And that's really helpful, both to justify our treatment, but also show the improvement that's designed to be in there. And so on this next one, we'll talk about the phases of rehabilitation, just kind of specifically identify those and talk about through them briefly again and wrap up.